If you're trying to figure out what it is that you're feeling, if what I'm having is lower back pain or something like that, or sciatica, then you're going to want to watch this video. Nearly everyone will have back pain at some point in their life, but with sciatica, you'll know that something's different right away. Pain that begins in your back travels right down the butt and shoots down your leg. It's a classic sign of sciatica. The shooting pain down the leg is caused by compression on the nerves exiting out of the spine. Let's look at that. So, we're looking at the spine, and if you have sciatica, what's going on? Even though we feel it down the leg and we think it's a leg issue, the lower vertebra in the back, the lumbar vertebra, you have 5. L1 through L4 especially, those nerves, they come together, they form this large nerve called the sciatic nerve that kind of catches here in the hip and travels straight down the leg. When you have sciatica, there is pressure in one of those places, sometimes up here in the nerves, sometime down in the pelvis, sometime maybe even down in the leg, but a lot of times it's coming from the source right there. Even a tiny amount of pressure can cause a tremendous amount of pain. So getting rid of the inflammation and opening up the space for the nerve is essential for finding relief. Pinching or compression on a spinal nerve can occur because of an injury to one of your spinal discs, like if you have a disc herniation, the development of a bone spur, or ligaments that have increased in size. There's a lot of things that can create this sciatica. Either way, it's likely to cause pain and discomfort. And until you can decrease that inflammation, open up space for the nerves, or improve the movement of the joint, until you do that, you're going to have pain. So, to recap, sciatica occurs when a spinal nerve gets pinched by a disc, a bone spur, or a ligament, and can cause pain that travels down the butt and the leg. Research has shown that 60% of people with sciatica benefit from chiropractic adjustments to the same degree as if they underwent surgical intervention, and that's without any of the risks. Exercise and rehab can also help strengthen the muscles. It'll support your spine and reduce the likelihood of a relapse. Pain, numbness, or weakness in the legs can be scary, and if you experience any of these symptoms, it is best to consult with us right away. Top research publications have shown that people struggling with sciatica can get fantastic results with chiropractic care. We have helped many people recover from sciatica without the need of drugs or surgery or anything like that. So schedule an evaluation today and take the first step towards sciatic relief. Guys, I'm Dr. Emil Tompkins. Have a great day, and we'll see you soon. But before that, let's take a look at something here really quick. So if you're someone who's dealing with inflammation, there's a couple of supplements that I tend to recommend from Biotics Research. One of them is called Caparest. I'm going to hold that here and see if you can see it. It's called Caparest. And Caparest, what it does is it is a natural anti-inflammatory. It's got a lot of the things that are found in the natural types of anti-inflammatories, things like certain kinds of, or curcumin, boswellia, green tea extract, ginger, rosemary, alpha lipoic acid, a bunch of different things that work on a lot of different inflammatory mechanisms to help lower that inflammation in the body. So it'll lower inflammation without having a lot of the side effects, which is nice. The other thing that we recommend when we're dealing with some of these inflammatory conditions is something called Intenzyme Forte. This doubles as a digestive enzyme if you take this right after you're eating. However, if you take this on an empty stomach, it actually helps facilitate soft tissue healing. So when there's an injury, when there's inflammation, the Intenzyme Forte, this proteolytic enzyme, helps to encourage soft tissue healing. So we have the Caparest, that's the anti-inflammatory. We have the proteolytic enzyme that deals with the soft tissue injury. You put those two things together and it makes a difference in your inflammation. So if you want natural alternatives to help you with inflammation, that's one thing to consider. It's also how we're able to help a lot of people with their sciatica. Number one, let's do things to help reduce your inflammation. Number two, let's do things to reduce the pressure on those nerves with chiropractic adjustments. That's why it's so effective. All right, guys, if you have any questions, definitely put the link definitely put it in the comments. Let us know what you think, some things that you've done to help with sciatica. If you want to schedule an appointment in our office, go to our website, tompkinschiropractic.com/schedule, and you will find you'll be able to schedule a time to come into our office and we'll be happy to serve you. Guys, I'm Dr. Emil Tompkins. I hope you have a fantastic day, and we'll see you later.